I'd like to call the program and budget meeting to order. And first thing I'll do is read the mission statement. Macomb County Community Mental Health, guided by the values, strengths, and informed choices of the people we serve, provides quality services which promotes recovery, community participation, self-sufficiency, and independence. I need a motion for adoption of the agenda.
So moved. Support.
All in favor? Hearing of the public. I have a hearing of the public. You have 5 minutes. Hearing of the public. Seeing no public will go on. Request to approve residence license, lease A. I need a motion.
Support.
All in favor? Residency lease.
Who's against?
Oh, did you say? I thought you'd raise your hand. I just was good. Yeah.
Now ask the other question.
Is there any no's?
There is one. Please record.
Okay, well, thank you. I was going to wait when we did the next one because I know you'll know that one too. Resident lease B. Can I have a motion?
Support.
Oh. Is there any questions? All in favor?
Aye.
Against?
Please record me as a no.
Motion passed. C, new policy, MCC MH MCO policy 1010, program integrity. Can I have a motion?
Well, I have a question.
Motion.
Questions? No questions? So, all in favor?
Aye.
Motion passed. Oh, anybody against?
Not on this one.
Okay. Motion passed. We'll go to D, new MCC MH MCO policy 1015, False Claim Act. All in favor?
Wait.
Oh, I need a motion.
Motion.
Support.
Any questions? Seeing no questions? All in favor?
Aye.
Against? Opposed? Motion passed. They all did their homework and read them. I did. Number E. Update MCC MH MCO policy 1001 compliance program. Can I have a motion? Any questions? Commissioner Shimatero.
Thank you, Madam Chair. Just one quick question. This indicates we have a board member on the committee, compliance committee. I'm just curious as to who that is. Is it the chair?
Pardon? I can't hear you.
I just wanted to know who the board member was on the committee.
It hasn't been determined yet.
Oh, it hasn't been named yet.
It hasn't been named yet because you haven't approved the policy yet.
Oh, so this is a new board.
Correct.
Okay.
It's a new requirement, so.
Your mic is not on.
Is that better? Okay. So after the policy is approved, then we'll move forward with assembling the new regulatory compliance committee, and that will include one board member.
And I'm sure they can get with our executive director or our chair, Kathy. All in favor passing this policy?
Aye.
Against? Motion carries. F, update MCC MHMCO policy 2022, specialized health service. Can I have a motion? Any questions? All in favor?
Aye.
Against? Motion passed. G, updated MCC MHMCO policy 2-033, advanced crisis plan, advanced directive. All in favor?
Aye.
Can I have a motion? Any questions? Commissioner Shimatero. Commissioner? Did you?
No, I don't have a question.
Oh, I thought you raised your hand. All in favor?
Aye.
Against? Motion passed. H, updated MCC MHMCO policy 2-070, allergy. Alert. I need a motion. Any questions?
Oh, that's the one I did.
All in favor?
Wait a minute, I do have.
Oh. Nick, I'm sorry.
Just a quick question, Kimberly. You've added or in the consumer's electronic medical.
Is your
record.
mic on, Nick?
Is it on? Can you hear me?
I can hear you.
Okay. You've added or, and it obviously makes sense to put it in the electronic medical record, but I've seen some occasions where the medical record, other systems have failed. The computers are wonderful things, but only when they work. Should that be an and or and?
It could be and or, but currently all of our consumers' medical records are electronic. So if the system fails, they don't have access to the medical record unless our backup systems work, which should be happening. So, they're off-site, and so it should be able to power up the system in the event that the main system fails.
Okay.
Any other questions? Seeing none, I'll take the vote. All in favor?
Aye.
Against? Motion passed. I, updated MCC MHMCO policy 8-008, behavior treatment plant review committee, behavior treatment plan and standards. Any questions? I need a motion. Now, any questions? All in favor? Oh, excuse me, Nick.
Kim, can you give us just a brief overview of the changes here? It was rather extensive, and I'm reading through it, and I was kind of getting confused. Can you tell us what the main?
Right. So
Differences?
the main changes are really the behavior treatment review committee wants to ensure that any intrusive techniques or restrictions for any consumer, that they approve those before they're implemented. And so they created some new forms to be more specific in what is actually being requested with more follow-up. They've included the parent-child interactive model to be reviewed at least quarterly. And so really it's just in order to make sure that clinically they're following the standards that they think are appropriate. I can't give you, much clinical information because the committee is actually the body that updated this policy. I'm just the conduit for it. So I know Agnes Ward will be here at the full board if you have specific clinical questions, but the updates were initiated by that
That's fine.
body.
Thank you.
Are you finished, Commissioner?
Yes.
All in favor?
Aye.
Against? Motion passed. J, update MCC MCO Policy 3-015, Contract Network Providers Mandatory Training and Workforce Development. I need a motion. Any questions? Commissioner Shimatero.
Yeah, Kimberly, I noticed that we're separating the in-house from the out-house, out of system
Correct.
outsourced in terms of the training for clarity and ease and easy to find, and that makes sense. But are there differences between the requirements, or are they the same?
No, they're the same requirements. It's just the contract providers, when the direct operated staff requirements are included, there's some confusion, particularly with.
Yeah, I have no problem with
okay, yeah.
separating them. I just wanted to know whether the standards were the same or different.
Yeah, they're the same, and you can find all the standards. There's a training grid, and that shows the required trainings. So to try and help to even clarify it further, they have a grid also.
Thank you.
Are you finished, Commissioner?
Yes.
Commissioner Doherty.
Thank you, Madam Chair. I'm just curious to know, and I don't know if we can answer this question, is there new, I've heard some of the providers expressing some concern about the required training and the impact on their budget and you know, having to pay staff to be in training when they really need them to be giving care and stuff like that. I mean, are we addressing, I don't know how else to address that, but I don't quite have the answer to it. I just didn't know if that was
I agree with
a
you.
concern in this policy.
The training grid actually shows where the requirement for that training came from. So sometimes it's MDHHS, sometimes it's a federal requirement, sometimes it's a state requirement. And so actually, if they looked at the training grid, they'd see where the standard came from so that they'd understand why we're implementing the training. And we don't disagree that there's a lot of training requirements. We just don't have a way to get around that requirement in order to be compliant with all of our contracts and all of the laws that apply.
Right. So I think the issue isn't so much about the required training, because I think everybody agrees that it's, in most cases, probably good training to have.
Right.
I think there's some concern about just the impact on the business model, right, and the expenses of it. So maybe it's not so much a question about the policy as it is
The hours.
to John. Yeah, maybe to John. Is there? I didn't see any indication on here whether some of that training is, if their hours are paid for during that, or if they're all paid. You know, I mean, obviously the employee has to be paid. The question is do we reimburse for those hours in every instance, or some instances if there's any funding associated with that?
I don't believe that we charge for our trainings, so that in itself I think is a big benefit to the providers.
Sure, yeah, and I think it's more, I think from a provider perspective, I think it's more about the fact that they have to pay their hourly rate while they're in training and not giving care, which means they have to find somebody to give the care and substitute in, yeah. So
Yes.
have we given any thought to that? And maybe it's a separate subject that we need to take offline, because it's kind of related to this policy, but not really. I just didn't know if the grid should indicate when the training is reimbursable through us or another funding source.
Good question. Let me just speak to it real quickly. There is a provider network or a staff training reciprocity work group that's working throughout the state of Michigan, trying to have same training throughout all the PIHBs and all the CMHSPs. I'll show it to you if I haven't already showed it to you once. It's extensive. And you would expect it so. We're dealing with vulnerable people. You would expect that our direct care workers have all the expertise that you would want them to do, to have to care for someone who's unable to care for themselves. That being said, the trainings that occur, the providers, if they're going to have direct care staff and competent direct care staff, actually have to pay the direct care workers for attending the trainings, correct?
Yeah.
They're not able to bill us because services are only paid for face-to-face. So our trainings are free. That does not remove the provider from having to pay for their staff. So it's and that's their issue. The training is so extensive, and it's all on them. And And then the other problem is if they can't retain their staff for a long period of time, they have to do it all over again, 3 months or 6 months or a year later. So it's a big issue.
So is there any exploration of any type of grant funding or anything that we as an agency could apply for to help defray any of this expense? Is there any way to look for that?
It's a good thought. None?
Grants are always nice. I think and we can look into those. I think the shortcoming with grants is when you look at a $200 million industry such as we are, to pick up a $25,000, $50,000, $100,000 grant, it's really a penny in your pocket comparably to what the real need is. If we were to do a calculation of the true cost of what it costs to put a direct care worker, one direct care worker, through all the core training and toolbox trainings, then multiply that cost times 4,700 workers, that would be your number, and it would be a big number.
Right. Is there any way to work with any of the other departments that the county works with, like Michigan Works or anything like that, understanding that there's a need for direct care workers, and see if there's any way for them to use grant dollars to offer even some of this training so that people are coming into the agencies or into the providers as trained staff? Almost like, I think about like a medical assistant training or something like that. Like they do some training in workforce development and things like that. Is there any way we could reach out and see if there's any potential source there?
Sure, I think that our training department and administration of that department can look at what is available in all other ways of collaboration, of in-kind supports that other agencies may be able to provide. Someone's going to bear the cost, but it's a great idea, yeah.
Yeah, I
Yeah.
mean, sometimes they have federal dollars for filling particular roles, especially given maybe an industry that has taken a downturn where people are laid off and there need to be retrained, and this could potentially be, just connect the dots kind of a thing. So just a thought. Thank you.
Are you finished, Commissioner? That's a good thought, though. I'll have to take a vote. Oh, excuse me, Commissioner.
Yeah, just to Susan's point, and John mentioned the reciprocity piece, that is in this proposal. I don't know if it's in this policy or a different policy,
It
but
is.
it's in here. And when I served on the boilerplate task force at the state level on attracting and retaining sufficient staff, one of the main provider concerns was that you often had to do the same training over when you moved from provider A to provider B, even though it was basically the same job and you'd already done it. It was a waste of everybody's time. So if we can work out that reciprocity, I commend you for putting that in there, because that was one of our major recommendations. I think that could help a lot, because it's silly to have to people move from provider to provider all the time and have to retrain somebody who just took the same training a month ago. I mean, obviously you have to do updates from time to time, but it's gotten to the point where we're wasting a lot of money on it.
There's a PHP work group regarding the training reciprocity that meets regularly that the training department attends, and they participate in that so that they can move forward with, adding trainings to that reciprocity.
And point of information?
Yes.
So I know, and to Nick's point, I remember when we had the big boil water advisory in the county during the major power outage that happened several years ago. And all the restaurants had to then, from that point forward, from the health department, had to do the boil water. And I remember they offered that training, and it was like $100 training or something like that somebody had to pay. But then they got a certificate that they then took with them, so that when they moved from restaurant to restaurant, they were certified, and it was almost like a hiring feature. Do we issue certificates and track? So, okay.
They do. They issue certificates, and they also track the trainings that
Okay.
are provided both at the training center and in Relias.
Great. Thank you.
You're welcome.
Any more questions? Seeing none, all in favor? Aye. Against? Motion passed. We're on K. Update and retitle MCC MCO Policy 10007, Direct Operated Providers and MCCMH Administration Training and Development. I need a motion. Any questions? Seeing none, all in favor? Against? Motion passed. L, or I, update MCC MH MCO Policy 5001, accessibility. I need a motion. Any questions? All in favor? M. Oh, against. Motion passed. M. Updated MCC MH MCO Policy 5002. Culture and Linguistics Competency Language Assistance Service. I need a motion. Any questions? Seeing none, all in favor? Aye. Against? Motion passed. N, update and retitle MCC MH MCO Policy 5003, grievance, allergies, discrimination, civil rights grievance, Title II, ADA Section 504, Section 1557, compliance. I need support. All in favor? Oh, questions? Seeing none. All in favor? Aye. Against? Motion passed.
Thank you.
Thank you for all your help. You must have did an excellent job because you didn't have any questions. Much. Oh, request to approve additions of appliance behavior analytic to quality care rehabilitation and autism center contracts. I need a motion. Any questions? Commissioner?
Thank you. Could we just have a brief, this is part of the transitioning to using a different service than what we had been. Could you just?
Is it the
Is this
same
the one?
service?
Is this the one? First of all, through the chair to John, is this the one?
You know, I'm
One
gonna,
of them?
it's the same service, the same applied behavior analysis line of services. We just need additional providers based on some previous activities that have been going on. If Christina would like to speak to that, and be welcome to entertain that as well, too.
Yep, John is correct. This is an additional provider that we'd like to add that would provide ABA services to those in Macomb County. Quality Care is a current provider with us, and they are providing occupational therapy, speech therapy, language therapy, and they have been with us for a few years now. They've been a really partnering provider. They have come to the table with ideas, with problem solving. If we need something, they're one of the first ones to step up and be there to support us. So they're already familiar with our processes. They already understand our trainings, and they're already working within our EMR, serving some of the population. Some of the families that they work with have already asked for this provider, not knowing that they did not currently provide ABA, so they come well recommended.
Great, thank you.
Any other questions?
John, you probably would be best to speak to this because that's what your degree is in, isn't it? When,
Yes.
well, tell me what it is. No, just kidding. When the autism law was first passed, there was a great inability to find people, and they just weren't in Michigan. They were in California, or there was you and a couple others. So how has that been, has that changed, and how did that happen? How did they get up to speed with the number of people that are needed to do this service?
They're still being brought up to speed. The legislature mandated the autism benefit. They originally rolled it out. It was part of Lieutenant Governor Calley's initiative, I believe. And then they originally rolled out the autism benefit for those to receive applied behavioral analysis services as an evidence-based practice for those people between 0 and 21 years. And right on the doorstep of launching the project, they backed it off to be 0 to 6 years. So it left a lot of people out. At the same point in time, they mandated a number of competencies that would be required relative to the delivery of those services. Starting out with a BCBA, a board certified behavior analyst. So there were very few, and there's still very few, there's more now, but there were very few at the time who were board certified behavior analysts who could step in and take leadership. I think they had maybe a caseload of 10. I'm not familiar with the clinical requirements, but perhaps a caseload of 10 consumers. And then the BCBA worked with a BCBA assistant who further worked with behavior techs who actually implemented the behavior plans in the programs. So there still is an absence, I believe, of the capacity to take direct care workers and make them competent BCBA techs where they really understand the principles of behavior analysis and use that to the benefit of the consumers. I think that there's an absence of BCBA assistants, and I know there's an absence of BCBAs because we just received our report yesterday, I believe, and our compliance is, we're out of compliance with our report. But we're not the only PIHP that's out of compliance with the reporting requirements and having adequate BCBAs on staff. So we're working with any providers who can bring them on board. One of the recommendations that Christine is going to talk about is a new provider from Colorado setting up shop here in Macomb County. I think we're as challenged as any other PIHP out there to have adequate BCBAs. That answer it?
Well, did the colleges admit more people up their programs, so that they were graduating more behavioral analysts?
Long time ago, only Western was the only college that had a BCBA. I went to California to get my ABA, and now there's more. I think Eastern, I don't know all the universities that now have BCBA curriculums, but there's quite a few of them now. And I think within the coming few years, you'll see this issue go away. You'll have a lot of ABAs out there.
Any other questions? I need a vote. All in favor? Aye. Against? Motion passed. Request to approve contracting with Trumpets Behavior Health for provisions of applied behavior analyst services.
So this is the provider that John just spoke about. We met with them a little over a month ago, and since that initial meeting, we've had weekly meetings with them to understand their system and to hear their clinical, their quality, and all their components of their organization. We're really excited to bring this one in front of you. I for one, think that clinically they had a really amazing team. We met many of their staff and continue to through the weekly calls. They have some practices in place that show the standard and the ethical behavior that they have within their organization. So they are securing a Macomb location currently. They have a site, I believe that it's in Warren. I don't know if they have fully signed that lease, but that's their intent. And so they're excited to get started. And just one piece of this provider that I'm also excited about is we are the only PIHP that they are currently seeking a contract with. So that supports, kind of the discussion here about the limited ABAs is we're not going to be competing with Oakland or Detroit or another surrounding county. They're just looking to start here in Macomb.
I need, any other questions? You supported the motion. All in favor? Aye. Against? Motion passed. Thank you. Thank you for your work. Q, approval to issue a request for proposals for NCQA consulting contract. I'm down to here. I need a motion.
Can I,
What? Oh, I'm looking at mine, I'm sorry. Sorry, I was looking at the old,
if I can just quickly help out, we had that on the agenda. We pulled that off this morning. So today's agenda, the most current agenda you should have, we took that off the agenda.
okay,
My apology for that.
I'm sorry, commissioners. Had the wrong sheet. Q, approval of out-of-state travel for USA National Clubhouse Conference. I think this is all paid by grants. I need a motion. Motion approved. Any questions? This is all paid by grants. All in favor? Oh, motion passed. Did I say that? Okay, all in favor? Aye. Against? Motion passed. You know, Phil happens to be gone, Commissioner Kraft, and this is his chair. I haven't chaired for a while. I'm okay now. Okay. Receive and file the mental health first aid presentation. So we're going to have a presentation.
Hello.
I'll take a motion after we see the presentation.
So good evening. I'm Stephanie Lang, and I'm with the CSI department. I'm an administrative consultant. I've been working here for about 11 years, and Mr. Kinch asked me to come and speak to you about what's going on with our mental health first aid initiative. So hopefully you've heard of mental health first aid by now. It's been around for a few years, not just in Macomb County, but throughout the state and the nation. It is a program that trains lay people of how to be of assistance in a mental health crisis until help can arrive. So if you can think kind of about like what CPR would be for someone in a physical crisis, this is kind of like CPR for a mental health crisis. So I just had a few slides added to your packet to make sure that you understood the concept of what mental health first aid is and why it is an important program for people to take part in. Kind of shows you here where mental health first aid can be the most effective. So you have prevention, you have early intervention, and you have treatment. So you can see that green shaded area is where someone could utilize the skills that they learn in a mental health first aid class. So this is just an overview. There's two kinds of mental health first aid. There's one for if you are an individual working with adults out in the community, and there's another one for if you are a person working with youth 25 years of age and younger in the community. So they're only slightly different. So I just kind of showed you some of the program overview here of what are some of the things that you learn. So you learn about all different mental health conditions that could possibly be notable or be part of a crisis that you could encounter in your daily life, including things like substance use disorders, and what are some of the helpful things that you could do, and what are some of the things that people might think you should do but could actually make a crisis situation worse. This is just a slide from the Youth Mental Health First Aid and the information that's there. So I know you have that in front of you. I did provide for you a small business-sized card that goes over what they call their algae action plan. So just like you would know the ABCs for CPR, the airways, the breathing, and the circulation, this is kind of our ABCs for mental health first aid. So I just thought it would be nice for you to be able to see a little bit of the materials and how we help remind folks to use those skills. This is our little bear. His name is Algie. So this originated in Australia. So this little bear is their little mascot, I guess. He's kind of cute in his little t-shirt there. So just to tell you now what's happening in Macomb County. since 2015, we have had 18 Macomb County adults that have been put through the 5-day training program, either for youth or for adults, to become facilitators. So to go in the classroom and to teach the class. And that was through grant money that was provided through the state. TTI, which is Training and Treatment Innovations, received one grant that we partnered with, and the Macomb Intermediate School District received another grant that we partnered with them. And of those 18 adults, I know it says 12. I have to correct myself. The answer, sadly, is 10 people are left in the county that we trained from the 2015 cohort. Unfortunately, we've lost a lot of people. They've moved on to different jobs or situations where they're no longer able to be a teacher for us. So we do know that that could limit some of our reach, but we have a plan, which I'll get to. Every trainer has to teach 3 classes a year to maintain their certification, and our employees from community mental health actually provide more than 3. So we're able to go out as part of our job. So the other people like CARE and the Macomb ISD and TTI that have people, they do lend themselves to us because we have the ability to get the most, I guess, people in our audience, if you will, or I call them customers that come forward and want to be part of the training. So we have to have 2 instructors that are teaching the class at all times. That's best practice, just because the material can be sensitive. Sometimes people become triggered or upset or need to leave the room, and we want to always make sure that someone can go with that person for safety reasons. We try to limit our classes to 30 people, but I have to say, Mr. Kinch, at the Stony Creek Church last week, we did allow 35 people. She wasn't kidding. She really got a group of folks there, so that was really successful. And we do provide manuals to every participant. That is meeting fidelity to the model. So those books are $20 a book, and we have been able to use grant money through this time. We have some more in stock, so we can continue to give those manuals. And I didn't bring samples of them, but if at one point you would like to see a sample of either the youth or the adult manual, I can make sure that Mr. Kinch has them available for you to view. The ISD has been a wonderful partner to us, and they actually handle all of our registration and all of the materials and all of the support and using their facility to provide our classes. So that has been really important. And we've been offering about 6 to 8 classes a calendar year for the community, and they're completely free of charge for people who would like to attend. We did apply for a grant. We partnered with the Macomb ISD this year for what's called Project Aware grant. We will not probably hear if we are going to be part of that until September, but we can give you updates on that as well. Just to show you what we're doing now, you can see over 1,300 people have been trained in Macomb County to date, and this does include a lot of students from Davenport University that are going through their nursing program come through, and then we also work with Henry Ford Health Services nursing program. The nursing students feel like this is really important for them because although the medical things are important, they've really enjoyed this. And we've also partnered with the health department and other Macomb County government organizations, school districts. We've been working with, you name it. We've been really getting a lot of requests, church groups. Thank you, Mr. Kinch. And so it's been very successful. So this is just for you to kind of see what's happening for the fall here. That August 1st was last week. We do have these youth and adult classes coming up. Some of them are closed, like the ones that we do for the Macomb Community College. They have enough customers in the college that they ask us not to open those up until the last minute, and they haven't had any spaces open, the ones we've done for them. So this just gives you an idea of the ones coming up. And of course, if you would like to take a course, the November 8th course is open. You can register at misd.net and come and join us to kind of get an idea of what's happening. Get your book and check it out. So our plan for the future is to continue to work with customers as they call CMH asking for classes. A neat thing happened too. We got a call from Phil Gilchrist. I don't know if you know him from the Anton Arts Center. He is the director there. And he said, you know, we heard about your class. We only have 10 employees though. So is there a way we could all hop into one class? So that's kind of neat. So even things like that kind of word is getting out, and it's been kind of exciting. So we connect the customers, whoever they may be. The police departments have called. We've been able to connect them with our trainers and get them their class. And we really hope we get the grant. But it's been pretty exciting, and we're just working on it 1 week at a time. And I think it's been pretty successful. Do you have any questions about the program?
Commissioner Doherty? And
Thank
then
you, Madam
Commissioner
Chair.
Vosper.
Wonderful presentation. I love the idea of this. I think it's, great to get the outreach into the community and help people understand what it, and identify issues when they see them, and more appropriately, not counsel when they really need to be referring someplace else.
Absolutely.
And just maintaining the situation until they can get them the proper help that they need. So, I'm curious to know, just thinking about the Anton Arts Center that you mentioned, do you offer this in a corporate setting?
Right now, I don't feel like we have the capacity to be contacting organizations and offering it per se right now, because we only have the 10 trainers. But as the word gets out, we have been able to meet the need of every customer who has called. And the classes are filling up right now. So I think there's definitely a potential out there for us to reach out. Maybe if we get this grant and we're able to train some new people. Part of the problem, like we were speaking of earlier with direct care workers and even our own county staff, it's very hard to retain folks and to get that commitment out of them. And so, like, we had 18 people. We were like, woo, we're going to be able to serve so many people. And it's just difficult to retain folks. So I think at some point that could be, on our roadmap for the future.
So in order to be trained as a trainer, you have to attend this 5-day, when do they
Yeah.
offer those, and what's going on with that?
Yeah, so this is kind of a little bit disappointing part of the conversation is right now the only way that you can become a facilitator is to go through the National Council out of Washington, D.C. And unfortunately, they charge about $5,000 a person. And without grant money, that's really kind of out of reach for us. And so we either have to wait until we get grant money, or one time the ISD got a special grant to bring the National Council to the ISD where we could pick people. And we also invited some Oakland and Wayne people as well. But that was only one time. And we already lost many people that were able to come to that as well. So it's just really expensive. And that's a little bit of a barrier to us being able to grow the program as large as we would like to.
Well, I have some thoughts on this. I won't keep us at the board meeting, but I'll get in touch with you.
Oh, feel free to email me or
afterwards.
call me at any time.
Okay. thank you.
Absolutely. Maybe we'll see you November 8th too.
Thanks.
Any other questions?
Yes, Commissioner Vosper.
Thank you.
Then,
Thank you very
uh,
much for the presentation. I took the training, I think maybe 3-4 years ago. Does it have to be renewed?
They suggest every 3 years because there are updates to it. So they do suggest every 3 years to get a refresher if you can.
Okay. And I just can't say enough about it because it really very helpful learning, just learning appropriate things to do or not do type of thing. And it also just kind of gave me a little more sense of boldness a few times to even engage with somebody who I kind of thought was having some thoughts that, and it's very helpful for that. So we can't get enough people trained in it, that's for sure. So it'll be interesting to see how else we can help grow this program. Is it offered by any other organizations in the area besides CMH?
Well, we are kind of the hub for it, but we utilize facilitators from organizations like TTI and CARE of Southeastern Michigan and the Macomb Intermediate School District. But to try to prevent everybody from offering classes willy-nilly, the ISD agreed to be the hub for the registration and the hosting, and we offered to be the hub for linking customers with a class so that things weren't duplicated. Unnecessarily. We're really trying to preserve our resources here and do the most that we can with the money that we have.
Right. Thank you.
Thank you very much.
Commissioner Bush.
When I look at the pie chart, I'm not sure where first responders fit in. When I have a real interest in us training more first responders.
Yes.
Wayne County does hundreds of first responders with different grant, different whatever.
Yeah, they have
But they're-
hundreds of facilitators
yes,
also.
Yes.
Yes.
But, and I understand that it's probably a population that doesn't step up to sign up for something like this because they, not the warm and fuzzy types. But what is your interest in getting more plans for getting more first responders?
we definitely would like to do that. There's been a couple of barriers. This is the same thing that happened with school staff, is because the class is an 8-hour day and you do have to stay to complete all the material in order to get your certificate. We've had some concerns, or I should say some of the first responder organizations have said it's really hard for us to give you a big group of our people for 8 hours in a row. And we've been trying to work with National Council. They've come up with a solution for teachers' unions and for teacher staff. School staff, they've created a pilot. Actually, I'm going to participate in it in a couple of weeks in Clarkston, where we're going to pilot a 6-hour version just for school staff. And I do believe they're going to be piloting some shorter versions that really target the needs of our first responders. And I think once we can get that under our belt and going, we're going to get more customers to come forward and say, you know what, we can't do 8 hours, but we'll do 6 hours. And that's kind of what's in the back of our mind right now, and we're kind of following the lead. I know Wayne County's done some amazing things, and we're doing our best.
Always. Thanks.
Are you finished, Linda? Could I ask you a question? Or maybe it's John will have to answer. What's the difference between our first aid here at the county and this? Is this a different class altogether?
Yeah, so this is not physical first aid at all, like you have a cut or a heart attack or something that's physically going on. This is for mental health crisis.
Okay.
So for someone having a panic attack, or for someone who's having maybe some psychosis or something going on with substance use. There may be overdosing or withdrawing or having some kind of anxiety or depression or suicidal thoughts. So this completely focuses on someone's mental health as opposed to physical.
Okay. And Stephanie, when did you say this? November 8th? Where is it at?
It's at the Macomb Intermediate School District, and anyone can register. You just go to their website. Under courses, you just type in mental health first aid, and the youth and the adult will pop up. And there are some youth classes happening this month as well that I believe are still open. We've got the August 15th is still open for youth, and we still have the November 8th open for the adult class. And the youth does go up to age 25, so it's not just for, teenagers and things like that.
And you said there was a cost?
There is no cost.
Oh.
Right now, it's been we kind of stockpiled books and materials from the grant that we had before it expired. So we're able to use that out while we wait to hear back on the new grant.
Okay. Oh, thank you. Is there any other questions from the commissioners? Commissioner?
One thing that I have used and that's been helpful to me and to other people, something that you teach in mental health first aid that I learned there. A lot of people are afraid if they meet somebody in crisis to even bring up the word suicide.
Right.
The thinking is that you don't say it because it would prompt them to do it. In mental health first aid, they actually say that you should ask, have you thought of harming yourself? And if they say yes, then ask them if they have a plan. And if they have a plan, then that's like an absolutely ambulance kind of emergency. I mean, it's like
Right.
a top level emergency. And that's made people that approached me about family members or neighbors or work situations, it's made them comfortable to ask that and have the person get help.
Yeah, like Kathy said, it boosted her confidence in knowing what to do and not being afraid to ask those really difficult questions that can be very awkward and uncomfortable, because sometimes we don't always want to hear the answer, but it's important to hear the answer so then we can act and keep people safe.
Okay, thank you. Any other questions?
Hi.
Hi.
I work for the Macomb Intermediate School District, and it's one of the trainings that, as staff, we are required in our schools to take every day at our first day of school, opening day, when they have it, is that we are trained to work in this, and it's been phenomenal over the last, I'm going to say, I think I've been doing it probably 18 years that we've been taking it. And as it changes throughout the years, but phenomenal, something great to learn. And it has been one of the most useful things we've had in our schools.
Oh, thank you for your input, Commissioner.
Thank you.
I'll take a motion to, all in favor? Or I didn't have the motion first. All in favor? Against? Okay, thank you much for your presentation.
Thank you very much.
Now we'll go on to MCCMH FY 2017-2018 accomplishments. And I think this is a presentation.
Yes.
Is it on here? No, it'll be on your.
Okay, so what we did was we sat around in executive staff and we always talk about how we can improve the system. And through that discussion, John came to the understanding, he knows how many accomplishments we have already had. So he asked that we compile those accomplishments and bring those to the board, just as an FYI. You guys always hear all of the problems that we have. And so for once, he would have liked that, he wanted us to present what we have done. So what we did at CSI was we asked all of the departments to compile some of the information that they had on some of the projects that we've done throughout the year. This is not all encompassing. There's been a lot more going on, but this is just a quick synopsis of some of the accomplishments that we've had throughout the year. Our mission statement, Macomb County Community Mental Health, guided by the values, strengths, and informed choices of the persons we serve, provides quality services which promote recovery, community participation, self-sufficiency, and independence. And that's what we predicate all of our services on. So as you can see on this slide, that's the market forces that are impacting behavioral health services. There's changing state and federal regulations that we have to make sure through our contracts with the state, as well as handed down from CMS, that we follow all of their regulations, and they're constantly changing. We are developing new and more efficient processes, including care management and enhanced coordination of care. We have more payers moving toward pay for performance, so we now have to measure our outcomes, and we're working on those measurements. And we, moving forward, have to partner with more managed care entities like Medicaid health plans and make sure we follow their regulations as well. The next slide is the executive governance accomplishments. So as you know, through being on the board, all of the things that John and Jim have accomplished throughout the year, this is just a quick look at a couple of those. They have worked with the state of Michigan legislature to secure a $5 million grant to support CMH, conducted community forums and legislative breakfasts in an effort to educate and support our community partners, as well as the board members, as well as our consumers. Developed a strategic plan, reappointed 3 of the CMH board members and newly appointed the 1, and identified performance improvement projects to meet and exceed standards for national accreditation. The facilities department. They've negotiated and renewed 47 leases and had a cost reduction and savings amounting to $183,000 through those efforts. They've developed data tracking and statistical analysis tool for residential leased homes. They've created the MCCMH Residential Group Home Task Force to make sure that our group homes are up to par and that any needed repairs are taken care of, and that's directly impacts the consumers. Implemented voluntary furlough day program. 40 staff so far have participated, to a savings of $60,000 to the organization. They've deployed and collected team member engagement and satisfaction surveys, developed a tracking system to monitor and analyze team member turnover and stability rates. In conjunction with the direct operated programs, they have worked to increase the psychiatric productivity rates from 36% to 55%, expanded employment recruitment efforts in order to retain staff and get staff.
Your slide needs
Oh,
to move.
I'm sorry. Okay. Business management. CMH completed the first year of the home and community-based waiver services with the current focus on the corrective action plans. The first cycle is complete. CMH has the highest completion rate in the state for the HCBS surveys. CMH has participated in a tri-county forum to provide education to the providers and community members on the home and community-based services. The business management team worked in partnership with other divisions to establish an efficient process for submission of clinical documentation, as well as reimbursement procedures for non-contracted MyHealthLink providers. There's been improvement with our Focus EMR, and that's been, I don't want to say a long process, but it's been very difficult at times to get the EMR up to date where we need it, and that's moving very smoothly. CMH was selected by the state to participate in a grant fund initiative to establish the Partners Advancing Self-Determination Group, and that's to promote the use of self-determination in Macomb County. They've established an internal work group, so through our HSAG audit, HSAG has identified that as one of the best practices that they've come across, this internal work group to allow for enhanced provider contracting monitoring. So we meet as a team to go over, all the departments meet to go over the different contracts and make sure that all of our providers are operating according to our standards. Business Management Department has completed an audit of the MCCMH Residential Provider Network and revised and enhanced the audit tools for all of the service lines. And we continue, as you know, to add new providers to the network to make sure that we can sustain adequacy and a robust provider network for the person served. Finance and budget. They revised the MyHealthLink payment methodologies to better align with the purpose of the demonstration project. One of our staff members from Finance and Budget was elected as Secretary of the Michigan Association of Reimbursement Officers, and that's a pretty good accomplishment. Evaluated existing claims and systems and identified issues that resulted in potential overpayments of secondary claims, and they fixed that issue. Aligned inpatient billing and coding with the current requirements. Trained network staff on the ability to pay and the fee determinations, and that was a large undertaking. We have a lot of providers out there. Coordinated rate negotiations resulting in cost savings to the organization. They implemented a monitoring practice of high general fund costs in the residential homes, and they collaborate with the Department of Human Service caseworkers to assist those consumers in getting Medicaid and to meet their spend downs. And then they coordinated express Medicaid billing verification audits and executed any corrective action plans. Access. Access developed the criteria and standards to assess the overall utilization of the B3 services. So those are the services that are discretionary. Those are the services that we are able to impact depending on the amount of funding, the amount of resources that we have. So we want to make sure that those services are provided equally across the board as much as we can, and so that was done utilizing the documented capacity. We've expanded our accessibility to the provider network, and assumed more authorizations. Our Medicaid fair hearings, so once an authorization decision is made at Access, if the consumer does not agree with that, then they will take it to a Medicaid fair hearing. Well, those Medicaid fair hearings, we tried very hard to make sure that through our authorization process, we kept things pretty stable across the board, that if one person got one type of service, the other person hopefully got the same type of service. And so through the Medicaid fair hearings, depending on medical necessity, through the Medicaid fair hearings, we were upheld 95% of the time. We promoted community inclusion for consumers in an effort to avoid utilization of higher levels of care. Maintained and acquired 24-hour services for all of our hospital screenings, substance use disorder services for pregnant women, pregnant IV drug users, Hope Not handcuffs, and the ASSERT program. Increased the use of diversionary services. So we decreased our recidivism in the last quarter. 15% is standard for the state. And for the last quarter, we got it down to 12.8. So that was a really good accomplishment. They've been following, the team has been following to make sure that people are in their correct level of care. We've cross-trained staff to cover essential job duties during the weekends and on holidays, and provided training and mentoring to Access managers in the use of the Medicaid billing codes and modifiers to make sure that we have accurate service authorizations. Clinical strategies and quality improvement. We've trained over 200 network clinicians in trauma-specific therapy and trained several law enforcement agencies and school personnel in mental health first aid. Secured many grants. We have 3 of them, the Integrated Care Grant, Technology, and the Drop-In Center. We've managed the key performance indicators, spearheaded the development of the hospital dashboard to effectively monitor and evaluate program effectiveness. So that's that AFIA program that you guys talked about last month. We've been working with them to get the hospital dashboard, which we're hoping that was one of the reasons that recidivism rate came down. So we're continuing to collect data on that to make sure that that is an integral part, and we're moving forward on other technologies with that grant. We've achieved above 95% compliance rate with the behavioral health treatment episode data set contract requirements, and we've launched a patient portal for consumers to gain greater access to their health information. The HSAG was on site, and we were acknowledged for being well organized and for having caring and positive staff. We have a social worker embedded at Henry Ford Macomb Hospital ED. We continue the implementation of the network-wide support intensity scale, and we have a community partnership with the Continuum of Care Board to work on issues of homelessness. We've also we are in the process of conducting consumer and provider satisfaction surveys. We are in the process also of compiling a benefit plan. So like with your insurance plans, you have a benefit plan. We're in the process of working on that. And we're working with other departments to streamline the consumer experience from intake to discharge. Direct services. Crossroads Clubhouse was awarded the 2018 Partners in Excellence Award. We were awarded a few grants, one of which is the Adult Mental Health Block Grant in the amount of $100,000, the Children's Mental Health Block Grant in the amount of $150,000, and Crossroads and Friendship Clubhouses received a grant from the department to assist consumers with Medicaid deductibles for the amount of $440,000. The direct services have begun in May of this year, open access, so we're offering same-day appointments for individuals. We started a hospital discharge program in August of 2017, and that's the same day appointment for individuals being discharged from the hospital. And we have actually had transportation where we will pick up the person at the moment of discharge and have them come for their intake. That way we can work with them on medications, make sure that it's a seamless transition from hospitalization back into the community. And we also started the Children's Mobile Crisis Stabilization Program. Ongoing services are the Dialectical Behavioral Therapy Program, or DBT as you might have heard it being called. The Forensic Department, we work with jail diversion and the mental health court, peer-led recovery groups, healthy lifestyle groups, walking clubs, family psychoeducational group, and consumer gardens. If any of you are at any of our sites, we have a lot of consumer gardens out there, and the consumers really enjoy working on those. Quality of care initiatives, we have staff trained and certified in over 20 evidence-based best practices. The Office of the Medical Director, so Dr. Joseph said that we have an ongoing participation in the Medicaid Health Plan and Prepaid Inpatient Health Plan Collaborative, the integration of Physical and Behavioral Health Care Collaborative, continuation of a systematic review of MCCMH's 1010 Integrated Health Strategy, and the 1010 is a decrease in the number of deaths by 10 years in 10 years. So at this point, our consumers tend to pass away at a much younger age, and what the initiative is an additional 10 years within 10 years. Review of data analytics using mortality data as well as events and circumstances to determine health-related trends and patterns. And we have hosted 20 Year 3 medical students from Michigan State University College of Osteopathic Medicine. So they come in for 4 weeks at a time and they complete a psychiatric rotation with us. The Macomb County Office of Substance Abuse accomplishments are that we have an expanded network at this point to include medication-assisted treatment sites, detox, substance use disorder residential homes, and additional recovery homes. MACOSA coordinated and presented at an opioid awareness community forum. They were awarded 2 Office of Recovery-Oriented Systems of Care grants targeting the opioid addiction, totaling over $2 million. They organized the Take Back Community events, planned and presented at the County Drug Enforcement Agency, assisted Chippewa Valley Coalition for Youth and Families create a vape curriculum, and promoted leadership presence on Operation RX, which is a countywide coalition to reduce the use and abuse of opioids in Macomb County. IT, information technology. So they have redesigned and updated the remote desktop functions, have implemented a standardized report request process, assisted in developing the hospital dashboards, and supported and strengthened CMH's use of data analytics. So that's going to give us more data on the back end, and we'll be able to prove our outcomes, and when it comes to pay for performance, we'll be able to prove that we can do it. Achieved compliance with the Integrated Care Organization contractual requirements for encounters, introduced a train the trainer model for focus trainings, and updated they are currently updating focus to include the Diagnostic and Statistical Manual of Mental Disorders, the 5th edition, the DSM-5, for diagnosis and treatment of persons served. So all of those are acronyms that we have spelled out. So there are a few other accomplishments that we weren't able to add into that. So I'll just mention a few of them. I mean, the staff is phenomenal in how hard they are working and what they're doing. So Currently, we are continuing the Commonwealth website to maintain searchable database of activities. We're working toward compliance with home and community-based waiver service mandate. We've increased the publicity of MCCMH services to increase our penetration rate and to give more services to more people. We continue the My Health Link pilot project, and we maintain trainings in ORR and the compliance department to ensure integrity within our system. And as you can see, successful men and women keep moving. We all make mistakes, but we won't quit. So, do you have any questions?
Bravo.
That's the whole team. I mean, everybody did a fantastic job. It really is. It has become much more of a team atmosphere, and we all work together, and it really is nice to be able to talk about the accomplishments. So I got the good training.
Any questions? I'd like to ask you about the one training. Were you going to the schools or the policemen?
Yes, the mental health first aid.
Yes. You know, we were doing that too in Warren, our fire department.
Okay.
Are they associated with fire department?
It depends on who asked. So we might have been part of that. I'm sure that we were. And that might have been handled by the Macomb Intermediate School District staff.
So it's handled by different departments. It might have been done by the MISD, is
Okay.
what Stephanie said.
Okay, probably. I'll talk to you later about that.
Yeah, when it comes to mental health first aid, everybody pitches in. So if someone is asking for a training, I've seen people trying to scramble to make sure we have enough trainers to do it.
So we need a motion on receiving and filing this presentation.
So moved. Support.
All in favor? Oh, any questions? No. All in favor, say aye.
Aye.
Against. Very well done. Thank you. Thank you,
Quite a list.
Director.
What's next? I'm afraid to ask. It was a good list.
Resolution. We have one resolution from, no?
That's the last month, just for them to read. It doesn't have to be approved, it was approved last month, it's just
Oh.
that they see it.
Okay, I guess it was approved last month. Anyway, I found a typo. Okay, other agenda items. Communication from the CEO.
Thank you, Madam Chair.
Are we going to talk about this?
Yeah, you want to talk about that now?
Yeah, I see our representative from Commonwealth in the audience. Come on up and give us a few words about your program. Is that okay, John?
I have a sheet for you. Hopefully you all received it. It's just a file, but I wanted they had so many accomplishments, and I just wanted to highlight some of the accomplishments about the Commonwealth website. And it's not just a website. It really is an initiative within our CMH. And it really is a place, a wealth of information for people to be able to go to that tool to find activities so that the people that we serve can make connections, so that way they can build natural supports and social capital, so that they can do things that they love, and so that the best parts about them can shine. They can let their strengths show. And that really communicates to the whole community that people with mental health or developmental disabilities are valuable, and they contribute to the well-being of Macomb County. And so I want this initiative, and really it has been really successful, honestly, in finding people ways of connecting to the community. I was told I'm told actually quite often by people who are working within our contract agencies that they utilize this site all the time. Some of our day programs go on the site every single day in the morning to find out where the people that they are serving can go and enjoy life and engage in the things that they love. So I'm really happy about that it's being utilized. And we also have, of course, other parts of this initiative beyond even the website that are really valuable for the staff and for community, those human service workers who are within the community, so that we can all connect with each other and find out the resources. There's all these different silos, but oftentimes the different silos don't know what each other are doing. So there may be health fairs, there may be book clubs, there may be housing information, and senior services. And all of us can help each other engage the people that we serve to really meet all different types of needs and self-sufficiency. I said I could keep going, but I'm assuming that's enough for now.
I know we use it in Warren. We use your program.
Warren, your library sends me things,
Yeah.
and there's a music society and an art society. There's so many beautiful things in Warren, so I'm really grateful for them.
Thank you. Commissioner Bosberg?
Do you need a motion to receive and file?
No, she wasn't on the,
Well, let's make a motion to receive
Okay.
and file. We'll have it part of our thing. But the comment I wanted to make was that it's just a great, even if you got company from out of town or grandkids, it's like something, you need
Yeah.
something to do and you're looking around. It's a great resource for
Thank
everybody.
you.
So thank you very much for all
I
the
go
work
to
that
so
you
many
put into-
things. Thank you.
See you around town all the time, right?
Thank you.
Thank you very much.
Commissioner Doherty.
Thank you, Madam Chair. So I applaud the effort that you have put into this. I know we've received presentations on it, and I looked at it when it was rolled out. I think it was, well, I don't know if it was rolled out or refreshed a few, recently since I've been on the board. I think it is a phenomenal tool. I applaud the effort, and I haven't been on the site lately, but I'm gonna go look. And I think that it is just a great way to satisfy some of the other issues that we see in the regulatory environment of trying to make sure that people with disabilities are not just tucked away, that they're part of our growth in our society. So I think it's a wonderful program, and I appreciate it. Thank you.
Thank you. And it's because John has allowed it.
Mhm.
So
Yes.
really, he let it thrive.
Good.
So
It's wonderful. Do you
Well,
keep
thank
track-
you.
Yeah, and I just want to know, do you keep track, you do keep track of the access? Do you keep, they have number of times they access the page? I mean, I see that you keep track of how many events or whatever. So the 8643 page views, is there any way to connect this data analytics wise to figure out what, maybe it's somebody that we can work with our social media program or something like that, to get a little more direction to this site, to
there's
get
a search
higher-
function, and we are able to identify who is searching for what.
Okay.
And we did that specifically so we could see what are people needing, what
Right.
are they looking for.
And what do they like, and, yeah.
Mhm.
Okay.
I have to say that I would love if I had more of that information readily accessed. It's a little difficult sometimes to acquire that information, but we did think of that in the beginning specifically for that purpose. So we're making sure that we meet the needs. And then if we find we need, let's say, bowling.
Right, that's what I was
a
gonna say,
lot
and
of
then
our
you could
consumers love-
reverse engineer it
You
to
can
say, okay, City of Warren Library, could you offer a program on this, because we've had people searching for this topic.
Yeah, a
true.
lot of historical stuff too. People want to go to historical informational events. But yeah.
Good.
Thank you.
Okay, our chair wants me to take a vote on receive and file. So I think we have a motion and a support. So all in favor?
Aye.
Against? Motion passed. Now, I'm sorry, I interrupted our CEO,
No, not at all.
but now you have the floor.
Yeah, thank you. What you do not have in front of you, but I want to run through it really quick with you, I'll make it brief. First off is, the administrative staff who did the presentation tonight. It's true, there's a lot that goes on every day throughout the whole year, and each and every one of them holds pride in what they do. Their work effort is tremendously difficult and challenging, but I think at the end of the day, they all have pride in their own ownership of what they do, and so we wanted to not only reflect that in ourselves, but also reflect that with the board. What we cannot take our eyes off of right now in the months and the years to come is that, real quickly, and I mentioned these with the board before, is that we need to continue as the board and the administration to pay attention to the PIHP contract, right? That's the mother of all interests that we have. That is don't take your eyes off the prize. Let's continue to make sure that we get a PIHP contract and that we're compliant with the contract with the department. That is our number one goal and objective, should always be the number one goal and objective, is to fulfill the PIHP contract. The second is the CMHSP contract as a public safety net. The third is the My Health Link demonstration, right? You've heard all that before. We have 5 contracts, and the state and everybody else is paying attention to us on our ability to work with private industry, the HMOs, to be able to complete and fulfill our downstream requirements with the My Health Link demonstration. Not everybody in the state of Michigan is doing it, but we are. And so those 7 contracts are our funding sources and our responsibilities as a board and administration. We spend a lot of time talking about being financially solvent. That's not going to go away. We'll continue to do that. Critically important as a PIHP. NCQA, or National Committee for Quality Assurance. We've talked about that before. We're CARF accredited. We also need to be NCQA accredited, and we're working on that feverishly as well too. The Home and Community-Based Services waiver is going to hit everybody throughout the country. It's going to affect Macomb County as well too. If you're not meeting the standards as a residential provider, a group home provider, a skill building provider, you will not receive monies, Medicaid dollars, if you don't meet the full integrity requirements of the Home and Community-Based Services waiver. So that's an important goal for us still too. We have 8 health maintenance organizations that we work with. Those 8 HMOs, we have a number of performance metrics in our contracts that we continue to show integrated care. So that's a goal that we're going to continue to work on. And mental health parity. Mental health parity is coming up, and we're all going to have to pay attention to that. All the PIHPs are going to have to work with the Department for Mental Health Parity. So those are the administrative things that are currently going on and what the board has been familiar with as far as the administrative issue as well. If I can entertain the board for a minute on what I think would be also something for you all to focus on, as well as administration too. How do we better move our system of care forward? More discussion on how do we better move our system of care forward, not only as administration, but as a board too. We have knowledge, you have knowledge, where do we go with this? I've been vocal before. I'm going to say it again on August 30th at the Metro Region dinner meeting. How do we work collectively with the Metro Region? I think we've lost our face and our voice as the Metro Region. At one time, the PIHPs, the Metro Region PIHP used to be the PIHP. The Metro Region used to be the region that everybody paid attention throughout the state. We have 65% of the people. We're losing our monies through rebates and through redistribution, but we have the legislative voice of the majority of the House and the Senate right here in the Metro Region, and I don't think we speak as a Metro Region as a whole as we should. Wayne County is big. Wayne County may not need Macomb County. We need Wayne County. We need Oakland County. We need collectively as a board, how is it that we can send the message, and what message do we want to send out to preserve the face of the Metro Region? And I think one of the suggestions would be is that the board chairs and the CEOs sit down, and we've done that before, sit down, the 6 of us, and have an in-depth discussion on how do we move the Metro Region forward. So there's 6 people that can have a day-long or a morning-long seminar. What do we do? But I think we can't lose that, and we've lost that. We also need to, in the coming months here after yesterday's primary, to continue to educate the legislature on where it is that we need to continue to have local control of dollars, to be the face of the community mental health services program, to fight off privatization, continue to be a public entity, and I think collectively as the board, we can take your guidance on how we should do that. I think we should send staff out, even though they have other jobs. They should go to coffee shops. The board members and us and I should go to coffee shops to listen to what the legislators are saying out there, to be able to hear what we're saying to them, to not give up on that. I think that's something the board and we all should do. Adequate statewide funding. The CMHA, Bob Sheenan Group, are pulling together adequate statewide funding initiatives because there's not enough money out there. You know, it's always about money. It should be about people. So there's not enough money, and we need to continue to make sure that mental health services receives adequate funding throughout the entire state. There are more and more unfunded mandates. Those who were at the executive board recently, and you're going to hear that coming out of CMHA too, Community Mental Health Association of Michigan. There's more and more that's being put on our PIHP as far as unfunded mandates, and it's crippling. We used to like to think that we kept our administrative costs at 5, 6, 7%. You know, that's getting out of control. You know, I don't think that we're far beyond that right now, but just by mental health parity, by example, it's going to cost $50,000 for us to implement mental health parity, and the department's not paying for it. It's going on and on and on, and I think it's a critical worry of the Board Association. And so we too, when we're working with the Board Association, we're at conferences, and I'll write this up again too. How is it we as a board demand or say like we need adequate funding? If you're going to mandate, you know, initiatives for us to do, then just fund us. That's fine. I think we need to also realign with the department, because we know Linda Zeller's gone and Tom Renwick's gone. I asked the board last month, who knows anybody else at the department? And we need to have a face with the department, either invite them down here in the next few months, or in January invite them down there, go up and visit them, let them know who Macomb County CMH is. Don't let them forget what happened down here. You know, if the new administration has no idea what happened down here in Macomb County and they only read about it in the history book, we've lost an awful lot. We can't let that happen. And so, right, wrong, or otherwise, how is it that we link with the department face to face so we know them when we see them in the hallway, that we're from Macomb County and who we are? And so we have to do that with the department. And I think those are some of the things that the board and the administration can work on. I think those are important things. So it'll keep us busy. There's plenty of things to keep us busy. What you do have in front of you is a letter from myself, and I don't think it was a surprise to you tonight. I kind of told you a couple of weeks ago it was coming. And per the terms of the contract between myself as a CEO and the board, it requires me to give 90-day notice of intent to terminate that contract. And so that letter that you're receiving right now is the 90-day notice of my intent to terminate. I also provided a similar notice to the county executive today. I just happened to be in my office 3 hours ago, so I didn't want to get head and board, but I provided him the same notice since he is a signature to the contract. And the letter's self-explanatory. I've been a voice for the people for 33 years. I'll keep being a voice, but it's time for me to retire from CMH. So I would like to retire on January 4th. So it gives the board about 4.5 months for succession planning. When I took over, I was interviewed in October. I didn't take over until March. That was about the same amount of time, 4.5 months. So I think it's a good, adequate time for the board to take its time and find other new leadership, those who would be insightful and somebody that will be able to continue to move the agency forward and work with yourselves and work with administration. You can expect my collaboration throughout the next 4 months. Any way you want me to help out, be certainly willing to do that. Look forward to that opportunity to continue to grow the agency. Appreciate the board for your perseverance. I think that was a good word that I used in my letter, to have perseverance in the challenges and the opportunities that are there. It doesn't come easy, and that's what it takes. To the administrative staff, that same perseverance, fortitude, I could say all kinds of things, stamina, patience. I don't know, patience has to be there too. But, all of those things collectively. You could say so many things about the administrative staff that everybody needs to have, but we'll continue to move the system forward too. To my wife, Lori, thank you. She's been an educator for 30 years, and I know an awful lot about the educational system, and she knows an awful lot about community mental health, I'll tell you what. So we've had lots of discussions, so I love you, and thanks for all your support.
Thank you. Other agenda items, commissioners? Doctor?
Well, in light of John's announcement tonight, he's leaving some big shoes to fill, and although we have 4 months, it's going to go by quickly. We're heading into a busy time of the year. So we need to meet as a personnel committee to begin talking about succession planning. There's a process that needs to be followed that we need to discuss. So I was hoping to set up a meeting sometime next week, and through the chair, I'd like to offer a few dates and get a consensus on what works best with everyone. So I was looking at August 15th, 16th, or 17th, probably a 7:30 a.m. meeting, if there's one particular day that works better. Correct.
The 15th?
I can't do it on the 16th.
How about the 15th?
15th, okay?
What about the 14th?
I can't do the 14th.
14th is a Tuesday.
Oh,
17th?
17th?
17?
Yes. Okay, 17th at 7:30 a.m.
7:30 Friday?
Yes. Right. Thank you.
also the 17th is the ice cream social for Crossroads at night. And also, if you want to come and do some putt-putting, support the Crossroads Clubhouse, we're going to be there. And it is beautiful now that it's been all redecorated and taken care of. So one of these days I'll invite you all down, or you can come anytime and see Crossroads Clubhouse. Very nicely done. Who was the Cavalier? No. Who's the owner, Cavalier? And I asked if it cost us, and he said no, he did all the improvements and didn't raise the price. But I don't know about that, but I'll send him a good letter. Thank you. Any other? Commissioner Doherty?
Thank you, Madam Chair. And I just want to say, I mean, I know there's going to be plenty of opportunity and time to say
Yeah.
all the wonderful things. So I just don't, but I don't want to, I was surprised by the email and the letter today. Well, the email originally, and I expected the letter today. But I just want to thank you. Thank you for all your service and your compassion for mental health.
Linda, Commissioner.
At the Association Executive Board meeting last week, I passed this out to you. This, they're saying that, you know, the fight continues for our public system, and that there may even be a maneuver in lame duck session to dash that quite easily with the stroke of a pen. So this is some talking points about why the public system is important. It is established in the mental health code, but and one of the points that they discussed, I think Linda Zeller talked about this a lot at the meeting. Well, she gave her farewell tour also, addressing social determinants, and it just reminded me of all the years where, you know, there's other things involved in health besides healthcare coverage, and that a public system allows you to have access to some of those, and to do collaborations with transportation or housing. There's a new movement, not new, but an emphasis in mental health on the employment services. So this is some talking points, and it reminded me of when people always say, oh, well, I pulled myself up with, through my bootstraps, but there are people who don't have bootstraps or boots or feet. So there's things that go in a public system that you wouldn't get with a privatized system. And so the message was to just be aware it's going to happen, and they're still at it, and we just have to keep up the fight till there's nothing left to fight for.
Thank you, Commissioner. Commissioner Vosberg, did you have your hand up?
I did. And I just wanted to echo what's already been stated, and there will be opportunities, John, to give additional praise and whatever else might be coming. But thank you very much for all your years of service to the mental health community. I've only known about what you do in the past 10 years or so. So this is again one of those kind of as time goes on, as conversations are held, it's like, wow, you did that too. It's like it's kind of it's very fulfilling as a resident of this community to know that we have people such as yourself and the many people here today who presented who care about our community and the people who need some of the services that you're able to provide. So thank you all.
Thank you, Commissioner. And John will be honored in Traverse with the Hellman Award this October.
I'm sorry, did you say that?
John for the Hellman Award?
No.
No. Gee,
Joan?
I appointed him.
Award goes to Bob Lathers this year.
Oh,
You misspoke on
I guess. I appointed you. I'll give you an award.
Thanks for the appointment.
Well, you got Joan's votes.
Yeah. Gee. That's on the Human Service Committee, right? That was on your committee that you chaired.
Madam Chair, can we move on?
Okay.
Every member has an independent vote
Yeah.
on the committee that I chair.
Okay, I'll give him some kind of award. Okay, any other agenda items? Then, now we'll hear from the public. Anybody from the public would like to speak? Anyone from the public, you have 5 minutes. Seeing none, this meeting's adjourned.